This is Informative Speech by Gina Drain. This is our audience panel who will be listening. This is Gina. Time to start.
What if I told you that there's a disease that affects more than 50% of the U.S. population? What if I also told you that if this disease, if left untreated, can lead to tooth loss, heart disease, and diabetic complications? Would you believe the majority of Americans, when told the name of this disease, do not even know what it is? I'm talking about periodontal disease. Periodontal disease can lead to tooth loss. It can be prevented with good oral hygiene and regular dental cleanings. If a patient is diagnosed with periodontal disease, there is a treatment to halt the progression of the disease. We'd all like to have a healthy mouth. Being educated about what periodontal disease is and how to prevent it or treat it if necessary will help us to keep our teeth for a lifetime. Having worked as a dental hygienist for over 12 years, I've treated thousands of patients. Some of these patients have very healthy mouths. Conversely, I have spent a significant amount of time screening for and treating periodontal disease. So in giving this speech, my goal is to educate you as to the following concepts. First, I will define what periodontal disease is and how to screen for it. Second, I will explain how to prevent it. And finally, I'll explain what's involved in the treatment. So initially, let's discuss what constitutes a healthy mouth as opposed to a one with periodontal disease. When we talk about a healthy mouth, we're referring to cavity-free teeth and a healthy periodontium. The periodontium is defined, so this shows the tooth. The periodontium is the gingiva or gum tissue, the bone, and the ligament fibers that hold the tooth into the jaw. So the most important thing for the determination of periodontal disease is probing depths. The probing depth should be from 1 to 3 millimeters, for we're talking about a healthy mouth. So probing depths are determined by inserting a periodontal probe in between the space between the tooth and the gum. And that area is called the pocket. So this is a periodontal probe. And this is the periodontal probe being inserted into the periodontal pocket. And this procedure is called periodontal charting. Regarding periodontal charting, RDH Magazine states, each patient needs to have a periodontal diagnosis, which is only possible by performing a periodontal charting. There are other factors, but that is the most important, the periodontal charting. So then factors that would lead to a diagnosis of periodontal disease would most importantly include probing depths that are from 4 to 10 millimeters. So now that we have determined how periodontal disease is diagnosed, let's look at how it can be prevented in the first place. Periodontal disease can be prevented by practicing good oral hygiene and keeping up with our dental cleanings. Now, why should we brush our teeth thoroughly at least twice a day, and why should we floss once a day? Well, dental biofilm, commonly called plaque, is the soft, white, yellowish substance that is constantly being built up on our teeth. If that is not brushed away within a 24 to 48 hour period, it becomes calculus or hardened. And a term for that, the common term for that is tartar. So this is an example of calculus or tartar on the teeth, which is hard. It cannot be brushed away with a toothbrush. Calculus is calcified plaque. It can't be removed with a toothbrush, and that's why a patient needs to have regular dental cleanings. Now, if a patient is not consistent with their brushing and flossing, a lot of calculus will build up above the gum line. So then the purpose of the 6-month cleaning to come in with a dental hygienist is to remove the calculus. The dental hygienist will use either hand instrumentation and ultrasonic instrumentation to remove the calculus deposits. The importance of the 6-month cleaning, Dimensions of Dental Hygiene states, multiple long-term studies have demonstrated the importance of professional mechanical plaque removal and consistent self-care in maintaining periodontal health. It is important to note, though, that a patient might have excellent oral hygiene, but some calculus will still build up. even though it may be minimal. So then if a patient has not maintained good oral hygiene and has not kept up with their regular dental cleanings, calculus will continue to build up above the gum line. But eventually, when the calculus has nowhere to go, it begins to accumulate below the gum line. So periodontal disease develops as a response to subgingival calculus, which is calculus that's below the gum line. The term below the gum line means in between the space between the tooth and the gum. So when subgingival calculus, which is rough in texture, develops below the gum line, good and bad bacteria adhere to it. Regarding the makeup of oral bacteria, periodontal disease states, the dental biofilm is one of the most complex microbial communities found in the human body and comprises more than 700 different bacterial species. So when periodontal pathogens, the bad bacteria, adhere to the subgingival calculus, the body's immune response goes into action, starting the inflammatory response. During the inflammatory response, the body sends out substances to fight against these periodontal pathogens. Regarding the inflammatory response, the book Unanswered Questions in Periodontology states, the immune system will be stimulated to form antibodies to the bacteria and their toxins that are found in the periodontium. So in its efforts to fight these pathogens, these substances attack the periodontium, leading to the destruction of the gums, bone, and ligament fibers. So the inflammatory process, if left untreated, can also not only affect the teeth, but affect other areas of the body. Uncontrolled inflammation from periodontal disease can lead to heart disease and diabetic complications. So then, in the scaling and root planing appointment, the dental hygienist removes the subgingival calculus that's attached to each tooth. And regarding the aim of the scaling and root planing appointment, Periodontology the Essential states, major aims are far-reaching reduction of bacterial load in the oral cavity and control of pocket infection. So during the scaling and root planing appointment, first the dental hygienist administers local anesthesia via injection, and then once it's determined that the patient is numb, again, she uses hand instruments and ultrasonic instrumentation to scale or scrape off the calculus that's on the teeth, and until the tooth is smooth. So at this point, you're familiar with what periodontal disease is, how to prevent it, how it can be diagnosed, and what can be done to treat it. So as I previously stated, untreating periodontal disease can lead to tooth loss and other health complications. This disease can be prevented with good oral hygiene and regular dental cleanings. If a patient is diagnosed with periodontal disease, there is a treatment to halt the progression of the disease. So being educated about what periodontal disease is and how to prevent it or treat it if necessary will help us keep our teeth and periodontium healthy. We can also avoid other health complications that are associated with untreated periodontal disease. So, don't we all want to have a healthy mouth? If you haven't seen a dental hygienist lately, call and make an appointment for a dental cleaning. The deal with periodontal disease is it affects 50% of the American population. You should care because being screened and treated for it can help you to keep your teeth for a lifetime.